Hi, everybody. Firstly, I would like to introduce myself. I'm Dr. Robi Tamargo, and I'm a COVID long hauler. Today is Sunday, January 25th, 2021, and I am day 265 of being ill. I'm going to have to look at my notes a few times because it's going to be hard for me to keep track of everything because of the injury to my brain. So I hope you can bear with me. Again, I'd really like to apologize to all my friends and family and support group that have been really working hard to provide me with the much needed love, support, and encouragement to keep fighting this battle, because it's been really grueling. I just have been off for social media for so long because I've just been too sick. So today I am trying to muscle up enough energy to record this video so that I can update everybody. My last video update was in September. The end of September, I was on day 150 of illness, and that's a lot of days on the roller coaster, but I have almost doubled that at 265 days now. Right after I had recorded that video, it was the last weekend of September, I was hospitalized for 5 days at the Baptist Hospital in downtown Jacksonville due to what they referred to as failure to thrive, adult failure to thrive. I basically began losing a pound a day over 7 days, and I communicated to my physicians, my neurologist, and my primary care doctors, Dr. Assad and Dr. Nioso, that I actually felt like I was dying. And they hospitalized me, and during that hospitalization I was diagnosed with postural hypotension. When I would stand up, my blood pressure would drop precipitously. So after that hospitalization, during that hospitalization, they also did a trial of different medications that would help with the profound insomnia that I have been on. And they tried Ambien, which caused me to have psychedelic hallucinations after about 2 hours and 50 minutes of sleep. So we learned that that wasn't going to work. Then we tried temazepam at 15 milligrams, which is a pretty large dose, and it still didn't put me to sleep. So they increased it to 30 milligrams. I still didn't sleep very long. They added trazodone at a very high dose, 150 milligrams. I still wasn't able to sleep. Then they added back 2 of my previous medications from Meltion at 8 milligrams and Dayvigo at 10 milligrams. With 4 of those medications, I was able to sleep. I was monitored with the oxygen, because I'm on supplemental oxygen at home, to make sure that the temazepam wasn't causing me to desaturate below what would be tolerable and safe, so that I wouldn't stop breathing overnight. After my hospitalization, I was discharged, just before, while I was in the hospital, I learned from my ENT doctor that my esophagus study, I think I had talked about that before, was a 24-hour study of a device up my nose, and it revealed 12% acid in my central esophagus, when 4% is considered abnormal. So I'm still waiting. I'll talk about that a little bit further. When it became obvious to my awesome physicians in Florida that I wasn't getting any better, they helped coordinate with my office manager, Patty, to connect with the patient coordinator, Desiree Bremer Fuentes at the Mount Sinai Center for Post-COVID Care to move my appointment up so that I was able to move my appointment to October 28th. So after I was discharged, in fact, the day I was discharged from Baptist Health, I went to see the dentist that I was referred to check on my jaw to make sure that the osteoporosis medication that I had just been diagnosed the week before with osteoporosis, it would be safe for me because it can cause jaw necrosis, and they needed to make sure my jaw was in good shape. And it is indeed in good shape. However, I learned that I had 5 fractures in my teeth, which many of the long haulers are finding out they're having. The endocrinologist started me on a medication once I was cleared called Resedronate, and it was approved by the Mount Sinai physicians as well. So that seems to be a really good choice. And the good news is that Dr. Merlin Omer, he's an amazing dentist, former active duty Navy dentist, is captain retired, and that's how we know each other from our time in the military. And he did a great job at repairing the 5 fractures for me. And when I return, he's going to take out the old fillings that I have and replace them with the new porcelain fillings that I now have on the side that he was able to work on. Next, I spent the following 3 days at Mayo Clinic for a lumbar puncture, a spinal tap, and an MRI of my brain. They revealed the same low monocytes, erythrocytes, eosinophils, and basophils that are often seen in COVID patients. There was no real new information. The brain MRI revealed encephalomalacia, which is from injury that I have sustained from stroke and transient ischemic attacks in my brain. Since I flew to New York City on October 24th, I began the process of having the initial intake evaluation at Mount Sinai. That resulted in referrals to a huge multidisciplinary team of physicians. And my referrals included cardiology, rheumatology, gastroenterology, pulmonology, infectious disease, electrophysiology, endocrinology, allergy and immunology, otolaryngology, neurology, ophthalmology, physical therapy, sleep medicine, primary care, and rehabilitation medicine. I have recently been given a referral to urology and follow-ups back to pulmonology and allergy and immunology, which we'll talk about in a little bit. I've been diagnosed with a litany of things, including COVID-19, daily fever due to COVID-19, palpitations, rashes, orthopenia, intermediate claudation, leg swelling, huge numbers of premature ventricular contractions, PVCs, along with a profound number of premature atrial contractions, PACs, atrial fibrillation, angina of effort, generalized abdominal pain, diarrhea due to malabsorption, nausea, other irritable bowel syndrome, unintentional weight loss. The greatest weight loss I've managed is 25 pounds. I've gained a little bit of that back. Abdominal bloating, abdominal spasms, gastroesophageal reflux disease, unspecified with esophagitis, arthralgia, neck pain, costochondritis, dizziness, tingling, weakness, persistent headaches, transient ischemic attack, memory disturbance, blurry vision, double vision, bilateral, and fatigue. Shortness of breath, hoarseness. As you can hear, I'm continually hoarse since day one of this. Insomnia of an unspecified type, myopathy, immunosuppression status, chronic pain of my left knee and left SI joint, headache disorder, dysautonomia, lack of coordination, post-COVID fatigue syndrome, excessive daytime fatigue, exercise intolerance, dyspnea on exertion, unilateral complete paralysis of my right vocal cord, dysphonia, throat clearing, nasal congestion, sinus infections, thrush, severe deviated septum, dysphagia, oral pharyngeal type, esophageal dysphagia, obstructive sleep apnea, a lung nodule, right kidney hypoenhancing lesion, mild hydronephrosis, urinary pelvic juncture blockage, T2 hyperintense lesion in the left hepatic lobe. That's in your kidney. My peritoneum shows trace pelvic ascites of an unknown etiology. I have small cataract in my left eye and a cataract in my right eye that the doctor said was similar to a 75 to 80-year-old. And that's what's causing my double vision in my right eye and the blurry vision in both eyes. Yes, my head is spinning at the crazy number of organ systems that are involved, and I'm sure yours is from listening to it. Unfortunately, I wasn't feeling well the entire week of Thanksgiving, and despite having a socially distanced, really fantastic Thanksgiving meal at our dear friend's house, I was very ill and became so ill that I was vomiting for 2.5 hours. I was unable to get out of bed for 2.5 days after that, and I am still struggling with significant daytime somnolence, which started on December 5th when I fell asleep sitting up during a video call. I still have zero restorative sleep, despite taking the 4 medications and having the supplemental oxygen at night. December 15th began a week of good news. My GI doctor, Dr. Ian Cohen at Mount Sinai, prescribed a special antibiotic for my gut called Xifaxan. I had to take it 3 times a day for 2 weeks, and it's helped me tremendously. I have had no diarrhea since. So that's why I've been able to gain a little bit of weight back. I think I'm about 103 pounds now, up from 98. Then we made the mistake of walking over to our apartment to spend Christmas Eve with our daughters, and I was unable to stay awake the following day. I couldn't get out of bed until 2:30 in the afternoon, and then about 4 o'clock I felt like I had enough energy to walk back over to spend the Christmas with the girls. So they waited for us to open their presents and to have a Christmas dinner together. Unfortunately, doing some of our Christmas traditions, I just fell asleep sitting at the kitchen counter. And then we watched How the Grinch Stole Christmas, and I was unable to stay awake during that. My family put me to bed, eventually awakened me to say I really did need to try to eat some Christmas dinner, which I did. I wasn't able to stay awake the following 2 days. So I had no idea that that little bit of walking would take so much out of me. It was indeed the first time that I had walked that far. The farthest I'd walked until that point was 200 yards, and that was about half a mile. So Monday, January the 18th, I was diagnosed with obstructive sleep apnea, snoring, and of course insomnia, which we already knew about. And I received the CPAP machine on Friday, January 22nd. Unfortunately, it hasn't been properly set yet. So I'm using it, which you can probably see the marks on my face, because I was awakening so frequently. I had to put the oxygen on underneath because I haven't received the valve yet to put the supplemental oxygen into the CPAP machine properly. So I'm waiting for that to come. I am scheduled to see the new COVID specialist sleep doctor on Wednesday, January the 27th. So if the machine hasn't been recalibrated by then by my ENT, I expect that I'll be able to get it redone then. On January the 19th, I had a profoundly terrible day. It was one of my worst days since Christmas. I was unable to get out of bed. I had only slept 4 hours on my sleep medications, and I got out of bed feeling so horribly, and went back to bed sleeping off, wearing my oxygen, and I was able to only sleep off and on. And then I got a bunch of abnormal test results last week. I want to share. I learned Tuesday night that I have some kidney and liver issues that were revealed on my MRI enterography that was performed by my GI doctor. And I'm awaiting appointments with the urologist for next steps. The liver lesion looks small enough at 0.08 centimeters. We don't get excited until they're 1 centimeters. And it looks like it might be a meningioma, and we'll watch it closely and have another MRI in about 3 months. Another finding from the MRI enterography is that there was a hypoenhancing lesion in my right kidney, a blockage of the urinary pelvic juncture, and right-sided hydronephrosis. And I'm awaiting an appointment with the urologist, and I was given an urgent number to call, so I will be making that call on Monday. I learned Wednesday that I have a solid mass in one of my lungs. This was discovered when I was participating in a cardiac MRI PET study. There are only 18 of these special machines in the country. I participated in it and found out that I have this solid mass in my lung. So I have a clinical PET scheduled on February 2nd with the follow-up with the pulmonologist the following week. The study also revealed cardiac inflammation, and the cardiologist and electrophysiologist both concurred that the atrial fibrillation and the outrageous number of PACs and PVCs are due to the inflammation. The study also revealed pleural effusion, which will be examined further with the bilateral pleural effusion, which will be explored more with the lung PET scan. My pancreas, and good news here is that I forgot to tell you that the cardiologists and electrophysiologists were very, very optimistic and said that the atrial fibrillation appears to be caused by COVID inflammation, and they're very hopeful that after I get well, following a year following that, I will be able to stop taking the diltiazem cardiac medication. And what they've been seeing with people that are further out than me, that they have been getting better and better. And I had a cardiac monitor again, and while it also showed wild numbers of PACs and PVCs like my sleep study did, I did not have any episodes in those 6 days of atrial fibrillation. So the medication's finally working and controlling that, and my tachycardia has come way down, and I still have pretty significant bradycardia episodes, but the tachycardia is much, much less. More good news, my pancreas and gallbladder looked great. My uterus and ovaries looked normal as well. So while the virus has wreaked havoc on so many of my organs, my brain, my eyes, my lungs, my heart, my esophagus, my voice box, my stomach, my intestines, liver, kidneys, skin, and muscles, there are several organs that it left alone. So that's a positive. I'm still fluctuating weight-wise. I am not absorbing nutrients very well. I was supposed to have an EGD with biopsies of my esophagus, my stomach, and my small intestines on Friday, but the anesthesiologist canceled it, saying that they didn't feel comfortable with how much I'm desaturating and my huge number of PACs and PVCs, and needing a CPAP, that they did not want to do it in the surgical ambulatory care center and wanted me to go to the hospital for the procedure. Unfortunately, as most of you probably know, hospitals aren't doing these kinds of procedures because all the doctors and nurses are very busy on COVID care units. So that'll be months. So my doctor's working on trying to get me clearances from the rest of my team to take back to argue the case that I can do it safely, and I can bring my CPAP for the recovery room afterwards. So I'm very hopeful, and please keep me in your prayers that I'll be able to get that done so we can finally understand the level of acid in my esophagus and how that might be contributing to the ongoing shortness of breath and the hoarseness that I'm experiencing. I'm still tapering off the prednisone. I'm down to 2.5 milligrams. As you know, I've been on it since I was hospitalized in August with atrial fibrillation. Today is day 4 of 14 at the 2.5 milligrams. So it's been an extremely slow taper from 60 milligrams down to 2.5 milligrams, because every time I have decreased, I've had a setback of symptoms. So we're taking it very, very slowly. I've started physical therapy, but can only do 3 minutes on the hand bike and 5 minutes on the leg bike before my blood pressure drops into the dangerous zone, and I have to lay on a gurney with my legs elevated. So I know that a PT is going to be a slow process. It's really hard for me as an athlete who was working out intensely an hour a day prior to getting sick, So, but I know that pacing is essential for COVID long haulers, and that team monitors my blood pressure and my pulse ox the entire time I'm in the physical therapy center. So they're watching closely. I'm also beginning rehabilitation medicine, and that should help with my brain, my heart, my lungs, as obviously in addition to physical therapy as part of that program. I want to say as I wrap up, thank you to everyone who loves me and cares for me. Your thoughtfulness, prayers, encouragement, flowers, gifts, presents, all the letters you've sent me, all the texts that you've sent me, the messages I haven't even been able to read, but I see I have over 150 messages on Facebook, and I promise I will read them. It's just really hard for me with the double vision and the cataract issue, but I promise I will try to do that as soon as possible. And thank you. You've all been an invaluable gift to me to help me fight this. It's so hard to believe that I'm over 8 months, coming up on 9 months in just a few days of battling this disease. And you have all given me the strength on days when I was just had no strength, and days when I just don't feel very well. But I wanted you to be able to see me and to see that I'm still fighting. I have not lost my spirit, I promise you. I won't give up. I'm going to continue to fight. And I love all of you very, very much. And just want to be able to say that to you publicly. And I appreciate you so much. I know that I can never imagine being able to repay everyone, but I sure will try. I love you all, and I'm sorry for the redundancy. COVID brain is absolutely real. I hope this helps educate other people about COVID long haulers, and that even as a doctor, you can still get COVID. I was doing everything that the CDC had told us to do at the time, and unfortunately I caught it from another doctor, and that's very common in lots of long haulers or medical professionals, because we gave it to each other. But it can affect anybody who gets this disease, and I just really want you all to protect yourselves. So even as an incredibly physically fit, healthy eating 50-something-year-old when I got sick, anybody can be stricken with this disease. Had I not been in as great shape as I was, lung and heart-wise, the doctors have told me that I wouldn't have survived. They also told me that I wouldn't have survived if I'd stayed in Florida, that I was just deteriorating. And so that stopped. I'm not really deteriorating. I'm just still stuck on an unwell plateau, with some things getting better, and these other things that are discovered now can hopefully get addressed. I have 2 asks. Number 1, please wear a mask. Please wear a mask to protect me. I have to wear 3 masks when I go to the Mount Sinai Post-COVID Care Center, and I'm not allowed to go anywhere else. They don't want me out in public because I'm immunocompromised, and I'm really subject to a lot of opportunistic diseases. I have had the flu shot, but I have not yet had the COVID vaccine. And we're not sure yet whether I'm going to be able to have it. Initially, they had said yes, but I had some labs that came back, and my IgM and 2 of the IgGs were quite low, so we're not sure yet when I'm going to be cleared to have the vaccine. So please wear it for me and others like me that you love, but also wear it for yourself, because the vaccine rollout is taking a long time, and it's going to be a while before we're going to have the true herd immunity. So until then, we've got to wear a mask. It's the best defense we have against this disease. So please, for me and your other loved ones, please wear a mask. But don't forget, it protects you too. My second ask is to get a vaccine. Help protect those of us like me who may not be able to get a vaccine. There are plenty of other people pre-COVID that are immunocompromised that cannot get a vaccine. So think about them too. These are our community members. So please look out for them. And when you get your invitation to get your vaccine, please go and get it. And the last thing I'd like to say is I love you all, and I'm sending you great big hugs, and thank you for loving me. Bye-bye.